Hi everyone, I'm Dr. Morgana Colombo, board certified dermatologist, founder of VidaDerma, a science-backed skincare line aimed to help women as they go through the aging process. And welcome to my webinar. Today we're going to talk about skin revival after 40, collagen, barrier repair, and beyond. So I'm going to get into like details of what happens to your barrier as you go through perimenopause and menopause, and what agents can actually help restore your barrier. We're going to also get into collagen loss and actives that can promote collagen and help you, and the science behind all of that. So stay with us till the end. We're going to have a Q&A where I'm going to live answer any questions you may have about the science behind aging and any VidaDerma product questions. Also, if you stay till the end, you can win a full VidaDerma sample of products. And anybody that stays till the end will also get a code for 30% off on any VidaDerma product you may be interested in through our website, vidaderma.com. I will see you soon. Your skin barrier is the outermost layer of your skin. It keeps hydration in, irritants out. This fatty protective seal of your skin significantly thins after age 40. The main components of your skin barrier are ceramides, fatty acids, cholesterol, and natural moisturizing factors. Um, After perimenopause and menopause, as you lose estrogen, a few things happen to your barrier. One is there's less lipid production. So during the first few years of perimenopause, there's 30% reduction in lipid production. So the skin is definitely drier. Number two, there's increased transepidermal water loss. So the skin doesn't keep that water in as efficiently. And as a result of that, you have skin that feels dry, flaky, tight. Number three, as you age, the other thing that happens to your barrier is it's not as effective in keeping irritants out. So that leads to chronic irritation, redness, stinging, and that chronic irritation is a huge promoter of collagen degradation. And then the last thing that happens is your skin is not able to self repair as well. So your barrier can't really heal itself as well as you get older. And with that, it's way less tolerant of active ingredients that you're placing on it. So, as you can see, lots of bad things happen to your skin barrier as you get older. It gets weaker, impaired in function. So, it's really important to repair that barrier, make it stronger so that you can then have like a healthy barrier that can be responsive to actives and other things that you need for your skin. So the first step in improving that barrier and stabilizing your barrier is moisturizers. So there are a lot of moisturizers out there, and they're not just supposed to be some cream that you put on your skin. So they should serve a function. And the function of a good moisturizer, especially as you go through your 40s, 50s, and beyond, as you go through estrogen loss, is to repair and maintain your skin barrier. So in our VidaDerma line, we have three moisturizers. One of them is our hydrator moisturizer. So this is our silky, lightweight moisturizer that is packed with hyaluronic acid and ceramides. And it's great for any skin type, sensitive skin, even oily skin. Great for people that don't like a heavy feeling moisturizer. Can be used at night or day, and it's going to allow for your barrier to be stronger and for more of a plump, hydrated look due to all the hyaluronic acid in it. Our intensive barrier repair moisturizer, we call the Restorer. So this is the moisturizer that is really going to restore the barrier of somebody that has a dry, flaky skin that really needs extra repair. It's our thick night cream. Can also be used during the day if you like that um, um, thick sort of texture. This moisturizer is packed with ceramides, lots of ceramides to really repair your barrier, fatty acids, cholesterol. It also has hyaluronic acid, but not in high amounts like the hydrator. The goal of this one is really barrier fatty layer repair. And it also has niacinamide, which further stabilizes your skin barrier. And all of that stuff is mixed in petrolatum. So it really gives you like this like layer that prevents transepidermal water loss. It really seals moisture in. Our third moisturizer is we have two of them, Age Eraser and Phytoester Age Eraser. They're pretty much similar. The phytoester just has some soy-based phytoestrogens. But the Age Eraser moisturizer is sort of in between the hydrator and the restorer. It has a medium sort of texture. It has your ceramides and hyaluronic acid for hydration, but it also is packed with a bunch of actives to really promote collagen, brightness, and pigment reduction. So it's a really great all-in-one moisturizer. If you're super dry, you can mix the hydrator with the Age Eraser or even the restorer with the Age Eraser or alternate them at night. But our VidaDerma line really offers amazing moisturizers for barrier repair. So, of course, we all talk about our face, but every single female patient I see, the first area that they notice the aging process the fastest and first is eye and neck area. So it's really important to get on top of protecting those areas and treating them at an early age. You don't want to just treat your face, you really want to treat your eye skin and your neck skin also. So our VidaDerma line has a few products to really help improve the aging in those particular areas. So for people that have really thick lines around the eyes, deep wrinkles, but also have kind of like not sensitive, but more like oily, resistant skin, and I would say male skin, my recommendation would be our refiner combo. So it's two little products that it comes with, and you alternate between each of them at night. And what the ingredients that they have are interesting. So one of them has a low amount of TCA, which is an acid that basically gives you like a resurfacing effect, almost like a laser on those deep wrinkles. The other little tube for the refiner has retinol, growth factor kinetin, and then a peptide combination aimed at tightening the skin a little bit to decrease puffiness and also decrease dark circles. So, and also, has, your hydrating agents. Our other option, which would be a better option for people with sensitive skin, for nighttime especially, is our eye neck complex. We call that. Um, but it's basically a cream that has a very tolerable but effective type of retinol called HPR, hydroxypinacolone retinoid, which is a newer derivative of retinol that is very potent but not irritating. And then lastly, we have our eye refresher. It's a lightweight, refreshing eye gel. Great for anybody, but especially people with sensitive skin that maybe don't even tolerate our eye neck cream. And also great for people using the other products, but maybe using the eye refresher in the morning. So this is an eye gel, very cooling, that basically has two main things. It has your hyaluronic acid for hydration, and it has a peptide combination that will help with tightening the area. And then it has a specific peptide called argireline, which has Botox-like effects temporarily. It relaxes muscles so that it decreases temporarily like those motion wrinkles around the eye. So great for, day use. Great product. Pairs well with the other ones, and or just as a solo product if you have very sensitive skin. But don't ignore your eye and your neck. You really want to address those areas, care for them with the appropriate products that can restore those areas for you. So as you go through the aging process, you lose collagen. You lose 1% per year starting at age 25. Once you hit menopause in the first 5 years, you lose 30%. So that's a huge loss in a very short period of time. And that's why people age very quickly after menopause. The skin looks looser, more fine lines, more wrinkles. So I often talk to my patients about the idea of collagen banking, doing either procedures or using skincare to promote collagen to make up for the loss. And I say do it, start that in your early 40s to really make up for that big drop that is going to happen once you hit menopause. When it comes to skincare, there are a few ingredients that promote collagen. You have your peptides, vitamin C, and retinol. And we're not going to get into peptides too much today, but we do have some products with peptides, with our age eraser, our eye products, and our plumper serum. The other two ingredients, vitamin C and retinol, we're going to kind of delve into those a little bit more. So starting now, retinol. So retinol is the one established ingredient, the golden ingredient in dermatology when it comes to anti-aging. It's been around for a long time, 40 plus years of data to support the benefits of retinol. So it binds the retinoic acid receptor on the skin, RAR, there are two of them, and stimulates fibroblasts to produce collagen type 1. It also diminishes the activity of MMP1, which is an enzyme that degrades collagen, so it decreases degradation of collagen. And it also promotes keratinocyte proliferation, so it exfoliates your skin. So we decided to use the newest generation over-the-counter retinol called HPR, hydroxypinacolone retinoate, which is a very special type of retinol molecule. It is a retinoic acid ester that binds directly to the receptor, so it doesn't need those enzymatic conversions. And with that, it doesn't lose potency, it doesn't become irritating, and it's stable. It's also an ester, which helps with the irritation situation, but importantly, it is a lipophilic, like lipid loving molecule. So it penetrates through your fatty skin barrier really well, gets to the dermis where the fibroblasts are, and promotes like effective results, which is collagen stimulation. And then also because it doesn't sit on top of the skin in the water layer, and it penetrates because it's fatty loving, it is less irritating. So great product, and that's what's different about our retinol products called Reverser 1 and 2. The other ingredient I'm going to talk about that is really important for collagen production is vitamin C. Vitamin C is around, is all over the place. There's so many formulations, so many different concentrations, different types. It is a great antioxidant collagen promoter. It stabilizes the triple helix of collagen fibrils. So it is a cofactor for enzymes that are necessary for that. So it's important in collagen formation. It stabilizes collagen. It's also a potent antioxidant. It neutralizes free radicals that damage your skin, and it decreases melanin production. So it's good for pigmentation. So it's a great ingredient to have in your skincare. The issue with vitamin C, just like retinol, is that a lot of like formulations over the counter are very acidic, very irritating, and that they're water based. They just sit on top of the skin and don't even penetrate enough to give you results. So what's special about our vitamin C formulation, it's a, we call it THD ascorbate, is that it's a vitamin C ester. Um, so it's not as acidic. It functions at a neutral pH. With that said, it doesn't burn or sting as much, which is really important because a lot of people can never find a vitamin C that they tolerate. So this one is a very tolerable vitamin C. But most importantly, I mean, of course, being tolerable is important, but most importantly, it's a potent vitamin C. It's lipid soluble, just like our retinol. It's a lipid loving molecule that penetrates through your skin, it reaches the fibroblasts, which are the targets for collagen production. Um, and it's stable, doesn't turn brown or and oxidize very quickly. So just like our retinol, it's gentle, potent, and stable. Well, I want to thank everybody who attended our webinar today. I hope it was educational to you and you learned a little bit about the benefits of improving your barrier, vitamin C and retinol for collagen promotion, among other effects, and how our line VidaDerma can fit into your routine and help you as you go through, the aging process. Stay to the end so we can go through a Q&A live. If you have questions, I will be happy to answer. And the winner of our free VidaDerma product will be announced through email. But if you attended the whole conference today, you will get a code to save 30% on any VidaDerma product through your email.
Hi, everyone. Thank you for joining me today. I'm still at the office. I'm a little cold here today. So I am here to just answer some questions. A lot of patients have tried our products in the last few months. We've had it since August. We're getting good results with those products. And if you have any questions about, skin barrier, moisturizers, neck and eye creams or treatments, just feel free to ask.
Okay, Dr. Colombo, your first question is, which should you use if you have bumpy rosacea?
So, bumpy rosacea, a few things to mention. So, rosacea skin in general tends to be actually extra sensitive. So, barrier repair in the setting of rosacea even more relevant and important. But rosacea, not it's not just barrier. There's always also inflammation going on, leading to the bumps. So for rosacea, you want to use something to address the inflammation and the bumps. There are prescriptions that can be used, and you can come to the office and we can prescribe those to you. In our line, we have an azelaic acid product that can be very beneficial to treating some of those bumps of rosacea. It's called the clarifier. Um, but of course, there are prescriptions also: Finacea, Soolantra, Metrogel. So you'd have to come in for that. But on top of that, you definitely want barrier repair. So of our line, I really like the hydrator in the morning, the restore at night for extra hydration. And we have one product in particular that I didn't mention today that is really great for rosacea. It's the wash. Our cleanser has this plant in it called Evodia. It's like a chamomile-like plant that calms the skin, and it's anti-redness. It helps with redness. So a good rosacea regimen would include the cleanser twice a day, maybe the clarifier in the morning with a moisturizer, and of course sunscreen, very critical. We have some good ones. We have some good tinted ones and a clear one. For rosacea, I would favor our dewy tint or the clear one. At night for rosacea, retinol is still a good thing and beneficial, but because the skin is so sensitive, you have to very slowly do your retinol. So prescription retinol tends to be a little bit more difficult for rosacea patients. So our refiner one, which is the HPR, non-irritating but potent retinol, could be a great option for rosacea patients. But I would say for those patients, start it once or twice a week, and with a moisturizer, restore or hydrator, and slowly go up in frequency. So that would be my recommendation for rosacea.
Okay.
And then I'll make just one comment. Vitamin C, which is a great ingredient for collagen promotion, can be especially tricky for people with rosacea. Our vitamin C is tolerable, but not necessarily for people with rosacea. So for those patients, if they want to try a vitamin C, I actually encourage them to potentially try our Age Eraser moisturizer. It has a smaller concentration of vitamin C that is way more tolerable. But again, because of the sensitivity of the skin, you would want to do the Age Eraser maybe every other night, alternating with the hydrator or restore moisturizers.
Okay. Can you recommend anything for really chapped lips?
So for really chapped lips, your key moisturizing ingredient is nothing that I have in this line, but it's actually Vaseline, petrolatum, or Aquaphor. What aggravates a lot of chapped lips is chapstick. Chapstick has a lot of ingredients that can cause irritation and make the chapped lips even worse. The other thing that is really important for chapped lips is hydration. So you have to make sure you're drinking enough water. If you don't hydrate, your lips are never going to get better. And if they're really chapped to the point that they're bleeding, then you may want to come to us for a prescription anti-inflammatory medication to help with that. I love tacrolimus ointment, but that's prescription only.
Okay. Do these products work well on darker skinned people?
Yes, so those products work well on all skin colors and really all skin types. You just have to pick the right product for your skin. But darker skin does very well with our products. Darker skin tends to be more prone to post-inflammatory hyperpigmentation, discoloration, and we have some great products actually to address that. I didn't talk about some of those today, but our brightener pads are non-hydroquinone lightening pads. They have kojic acid or butane. They're great lightening pads that help a lot with like brightening up darker skin. Our clarifier, the azelaic acid that I mentioned for rosacea, is also good for brightening up darker skin if in case of like, uneven coloration. And we have something that took me a long time to find, a really nice tinted zinc sunscreen for darker skin, complexions. We call it the Tint 2 sunscreen. It blends so nicely. And the zinc based sunscreens, the physical ones, tend to be way more effective for preventing that discoloration or post-inflammatory hyperpigmentation that a lot of people with darker skin will have. um of course, when it comes to like barrier repair, retinol, vitamin C, the skin color doesn't really matter. It really is more of like a sensitivity issue. So if you're more sensitive, you're going to aim for heavier moisturizers, being a little bit gentler with actives, starting them less often. If you have, more oily or normal skin, you can, do reverser every night, a booster, which is the vitamin C every morning, and then the hydrator moisturizer is sort of one that a lot of people with more normal to oily skin favor.
Okay. When applying the eye and neck complex, does it go under the eye and on crow's feet area? If I'm already using a prescription Retin-A, is it okay to use other products with retinoid from your skincare line?
So I would probably not do prescription retinol and our product at the same time. For the eye area, I would probably favor our product. It has the retinol, the HPR molecule that is going to efficacy wise be very similar to prescription retinol, but it's way less irritating. So much better for like the gentler, thinner skin of the eye and neck. But it also has other ingredients. It has the peptides that can boost a little collagen, give you a little like anti-puffiness effect. It decreases like a little bit of like the dark circle discoloration. And it has also, of course, the hydrating effect. So if you have retinol prescription, I would apply that on the rest of your face and do the one of our eye products under the eyes. And then the neck, we have the one product, the eye neck, which comes in a big tube that can go on the under the eyes and on the neck. And of course, you can also treat the upper kind of like eye area, not the eyelid, upper eye area.
Okay. Is it best to come in for a consultation to decide what products will be best for me?
If I have a lot of educational videos online, like on Instagram, on Facebook, on YouTube. I'm actually trying to grow my YouTube channel, so I really appreciate if any of you guys would subscribe to the channel to help us grow, so so the algorithm of YouTube helps. So yeah, I would go on all those sources and the website VidaDerma.com and read about stuff, because we have put out so much information to help people make the right choice. But let's say you read all these materials, you attended the webinars, and you're still not sure. Of course, come in, let me talk to you and give my recommendations in person.
Okay. So are these products available to order online?
Yes. So they are sold, in the office, but also online through our website, VidaDerma.com. We actually have a holiday sale going on right now. It's 30% of one product, and I think it's like 35 of like bundled products. And I know when I had initially taped this video, we didn't have that sale. So I'm actually, to whoever attended today, I'm gonna give you guys a code for a higher amount of discount, because you did this for me, so I feel like I'm gonna thank you. So I'm gonna give you guys a code for 40% off for everybody that attended, and then of course I'm gonna pick one winner where I'm gonna give like a full sample, full like bag of like VidaDerma products for that person to try. But yes, we do sell online, and right now is the time to try because the products are, on sale for the holidays. Great gift for, any relatives, there are women, especially women 40 and up, that can, really benefit from, like a higher end medical grade skincare line. And then I'm going to explain to you guys what the difference is. So medical grade skincare allows us to put more actives and more, more sort of like power ingredients in the products. The regular stuff that you buy at CVS never has that many actives, so that's why it's not as effective.
Okay, that was another question. So you answered that one. Is there any ingredient overlap that could irritate my skin?
So, so for people that have a ton of prescriptions, um, sometimes there can be some irritation overlap. I would probably, if you're gonna do, let's say, vitamin C and retinol, not do them at the same time. I'd probably do the vitamin C in the morning with either like a hydrating serum. We have the plumper one. There is like a hyaluronic slash peptide serum, or a moisturizer. The hydrator is really nice in the morning. So vitamin C hydrator, sunscreen in the morning. Then at night, you could do the retinol reverser every night or every other night, depending on how sensitive you are. Even every 2 nights if you're super sensitive. And then a good moisturizer. I mentioned 3 moisturizers: hydrator, restorer, plumper. So if you're oily, I'd always do the hydrator. If you are like dry or sort of like more normal skin, but 40 and up and it's winter time, I would favor the heavier moisturizers, Restore or Age Eraser. Um, the Age Eraser I love for a glow effect because it has all the actives. So you could, do that one, maybe alternating with the Restore, pair the Restore with the Reverser. So there's lots of combinations of product that you can use. But I think the key thing is I wouldn't do like 500 serums and then a moisturizer. I would limit yourself to 1 or 2 serums and then a moisturizer.
Perfect. Are there any procedures that you can recommend to help stimulate collagen in addition to your skincare products?
Yes. So skincare helps, but it comes nowhere near what procedures can do. So if you really want to take your skin the next level and reverse big changes. So what you see as you lose collagen is the skin is more lax. So the jawline is not as defined, the neck is looser, fine lines, deep lines. So that's what you see as a result of collagen loss. Um, Creams, of course, help, but they're not gonna come near the procedures, like I said. So procedures that are helpful for collagen are gonna be, we have tightening devices. There's Ultherapy, which is an ultrasound machine that heats the skin really deep, more superficial, great for like tightening lower face. I love that one for younger women, 40 to 50, and I tell them to do it every year. Great for collagen stimulation, no downtime whatsoever. It hurts a little bit, but tolerable. Microneedling with radio frequency is also good for promoting collagen. The heated needles promote collagen through the radio frequency. We have a regular one that we call a regular device, and we have one called Profound, which is a more intense one. The regular one, we recommend 3 initial treatments, then repeat once a year. Profound is 1 intense treatment every couple years. Also a good option. And I typically would go with the more aggressive one, the Profound, in women like 45 and up. And it can be done with the Ultherapy or as an alternative to the Ultherapy. And then there's a third device for skin tightening, is the Ellacor. We do micro cuts on the skin, so we remove a little skin, and then that removal also produces a ton of collagen through inflammation. That one, again, it has downtime, so women 45 and up benefit more. And then of course lasers. Lasers can heat the skin deeply also, and that is great for collagen promotion. Fraxel, fractional CO2, and the ultra clear, which is a fractional erbium, they're all great lasers to also promote collagen. So lots of devices to promote collagen. And then lastly, Sculptra and Radius. Those are injectables that we typically would inject on the neck, lower face, temples, and they also promote collagen. So if you're thinking about a full treatment to improve your face, your skin, your collagen, I would definitely say come in, let me talk to you, and we can, come up with like a full treatment that will work for you. But skincare is always a good start, and also important if you're doing treatments to, optimize your skin and keep your results for longer.
Great. Of the treatments you just talked about, which one is best for sensitive skin?
So they can all be done in sensitive skin. Sensitive skin is not an exclusion for any of those treatments. The difference is when you have sensitive skin, you just gonna maybe take a little bit longer to heal. Old therapy is the one treatment that doesn't have any downtime. So that probably it would be the easiest one on sensitive skin of the tighteners. And then of the lasers, the Fraxel, Fraxel, the non-ablative laser is probably the easiest one on sensitive skin.
Great. For those treatments, do you have products that you recommend to use after to help with healing to then be able to start your skincare regimen?
Yes. So for the more aggressive treatments, we actually have a healing kit that basically actually has our cleanser, the wash, which is very gentle. It has our dewy tint sunscreen, and then it also has like this silver ointment that speeds up healing. But mostly I recommend that for the more aggressive treatments, such as like the CO2, the erbium. For milder treatments, we recommend something different. Is the elastin regenerating nectar. It helps the redness go away a little bit quicker. But for let's say old therapy, the key is just moisturizing hydration. So aggressive treatments, that's when we have a healing kit.
Okay, perfect. Well, the questions are wrapping up. Do you want to tell everyone who attended their special code for their 40% off?
Oh, so I'm gonna email
Okay.
people with a code, and then all they have to do is punch it in, and it will be good for one use up to a year from now. So you have the whole year to think about when you want to use this.
Okay, perfect. And everyone who attended this webinar will also receive a text immediately following this event. And if you'd like to come in for a consultation, you can text back Reston, Reston, and Dr. Colombo's office will get back to you.
I thank you so much, guys. I know, at the end of the day, everybody's busy, has so much going on. I really appreciate, all of you for being here tonight. And I hope you learned something. But if you still feel like you need to learn more, just make an appointment and we'll talk about whatever you want to talk about. All right. Good night.